Hi, everyone. Welcome to this session. Here we have two more presenters to talk to us. We have Alice and Seth. I don't know if both of you are with us.
This is Agnes, not Alice.
Oh, Agnes, yes. Sorry, my apologies.
Yes, I'm around. Yes.
And Seth? I just want to set this up. So Agnes is from the African Population and Health Research Center, which is Africa's premier research institute and a think tank, generating evidence to drive policy actions to improve the health and well-being of the African population. So Agnes can go ahead, and while we wait to see if Seth will be able to join us. Agnes, you are apparently muted. I don't know if.
Oh, sorry. Sorry
yes.
about that. Yes, yes, I'll talk about the data science program at the African Population and Health Research Center. This is a Pan-African policy-oriented think tank research institution headquartered in Nairobi and with a West African regional office that is in Senegal that was opened up in 2019. There's a lot of work that is ongoing, particularly around research and research-related capacity strengthening initiatives in over 35 countries in Africa. And this is through a partnership model that the center uses to conduct research in several African states. So the APHRC is a multidisciplinary team, predominantly African staff, and about 200 of these from all over Africa with skills around demography, public health, anthropology, biostatistics, data science, and economics. And most of the staff come from close to 20 African countries. So the mission of APHRC is generating evidence, strengthening research and related capacity in Africa research and development ecosystem, engaging policy to inform action on health and development. Like we said, we do a lot of partnerships in the different countries with a lot of work around tracking the impact of this work and knowledge management so that we can actually be able to inform policy in the African continent. So this slide talks mainly around the key programmatic areas at APHRC. We have a program that is focused on health and well-being. And in here you find lots of researchers doing work around nutrition and food systems, sexual reproductive health, chronic diseases, health system strengthening, emerging and re-emerging infections. And on second to that is the human development. These are researchers doing work around early childhood development, youth and transition in Africa, gender and education, education and technology, and of course, research around higher education in the different African states. And then the third research area is around population dynamics and urbanization. And here, most of the work is centered around migration and urbanization in Africa, urbanization and sustainability, looking at WASH, water sanitation, and hygiene, aging, development, determinants of high fertility, high and low fertility, but high fertility, particularly in certain parts of Africa. And then we also have the urban health and demographic surveillance, one of the sites that is housed in Nairobi. And then the latest to the three is the new data science program that is really focusing on data science and evaluation. And if you've been to the previous session, we've talked about aspects around creating federated platforms. And this is one of the core activities for the data science team. We are doing work around data governance and sharing in the African context. We are also applying machine learning, artificial intelligence, doing work around mathematical modeling, and capacity building in aspects of data harmonization and making data fair for African data professionals, so that we can build a community of data teams that are actually embracing the new technologies and systems that are available. So we use a system thinking approach where we believe that we need to tackle the whole system of the data value chain with different aspects of the program activities in the Institute. So this is just one of the goals of the data science program. We maximize the power of data for health research in Africa through African-led data governance and sharing approaches for state-of-the-art big data analytics to foster advances in livelihood for effective research. And we really focus on data governance, looking at data sharing, creating avenues and systems that can help us curate the data, create ETLs. We've had a talk earlier on the creation of ETLs in Rwanda. So we're also doing a lot of work with the different data sets that are produced within the center, and through the partnerships, we create codes for this. We are developing a data sharing center. And in all this, we are really building capacity around creating data models, common data models, making machine readable metadata, and of course, making the actual data sets findable, accessible, interoperable, and reusable. And we believe along this journey, we are encountering different aspects around data standards, vocabularies that need to be modified or changed for the African data sets. We are seeing a lot of standards or vocabularies that need to be modified if we are to actually harmonize and standardize some of the data in Africa. We believe in an open science platform, and increasingly we are working with partners like the IDEA to create no-code platforms to enhance data analysis, even for teams that are not really highly trained in data science. And with that, we should be able to move on with skills around application of machine learning, AI, and mathematical models. And that is really the core hubs of the data science program. And as part of the data science program, we do have a use case. And this is a use case of a data that is coming in through a collaboration and a partnership that is hosted at the APHRC, that was founded in 2019 with a team of, I think I've seen Jim Todd in here, a couple of researchers and population public health specialists developed or formed the INSPIRE network. And the INSPIRE stands for Implementation Network for Sharing Population Information from Research Entities. And this is a network that is looking at different types of data, but its primary focus was population health records, longitudinal population health records from health and demographic surveillance sites. To date, we partner with about 15 HDSS sites in Africa from around 7 countries, some from the Anglo and Francophone speaking areas. We propose to have hubs in different parts of the continent to promote the INSPIRE network and have access where data can be shared and made accessible in the different hubs. So the INSPIRE strategy really is to make this data fair. We're promoting data as a digital public good, customizing African customizing existing vocabularies to match some of the data that is coming in from these different parts of Africa. And we hope that the INSPIRE can be able to contribute to the SDGs. We can track the Sustainable Development Goals in Africa through the community generated data from these health and demographic surveillance sites. We are doing work around estimating global burden of disease in these communities and how this can actually be how this can actually augment the existing international standards of GBD, and of course, promoting health literacy in the African communities. So as I almost come to the close, we know that the HDSS sites are strong partners for us. We do a lot of work around augmenting the data from these demographic health surveillance sites to inform public health. We are looking at work around non-communicable diseases, mental health, diabetes, and other types of diseases in the communities in Africa. We are also using surveys to augment the data from these HDSS sites by collecting data on nutrition and food security, sexual and reproductive health, combining these with climate. One of the new things we brought on board is looking at the climate indicators in all these population cohorts for a period of close to 30 years and using data science methods to combine and predict health outcomes in the communities using climate. And this is something that is really taking a footprint in the HDSS sites. We also combine this data with facility-led data from DHIS to platform, and also other existing projects like A Countdown 2030, which is really focusing on maternal health outcomes. So we believe that as a public health institute, we should be able to contribute to continental and global indicators, particularly around the Agenda 2063, that Sustainable Development Goals, and also human rights indicators that critical to the livelihood of persons in Africa. And I think that is my last slide, and I'll welcome any questions. Thank you.
Thank you very much, Agnes. So we were expecting Seth from the Economic Policy Research Network, but apparently he's not here. May I know if there is a representative? Otherwise, I would like to invite questions for Agnes, if there are any questions. There are a lot of comments, great presentations. I haven't seen any question yet. But of course, if you would like to talk, you can just raise your hand and then I'll permit you to do so. From Benson, do you have any public data repository, Agnes?
Thank you, Benson. So at the APHRC, we do have a microdata portal, and this is a portal that is storing all the data from the numerous research projects that are conducted at APHRC, and it's one of the data sources that we are leveraging the power of common data models. We are harmonizing some of this data to take using the OMOP, which we've already had earlier on. If you were in this breakout room, the observational health medical outcomes partnership model. And this is work that we're doing with a lot of collaboration from the London School of Hygiene and Tropical Medicine, from the CODATA. And so in this public repository, we do harmonize some of these data sets, and they're actually readily available. And what we're doing right now is to actually make them machine readable. We are creating metadata sets for metadata for these researchers, and so that they can actually be, available, at least findable for the start. And if you actually want to make them, if you actually want to use some of this data, we can actually reach out to the institute and have access to this data, because they're actually already available and available for research. But on the part of the Inspire, and I think I have my colleague here, Jim Todd, who might chip in, is that we are planning to create a federated approach where data from the from the HDSS sites that we partner with is operated under federated approach. So we create ETLs and OMOP, common data instances, OMOP instances in the different HDSS sites, and then create these, the ETLs that we've seen earlier on. We extract, transform, and load this data to some platform or cloud-based platform that we are planning to host with the Microsoft Azure or Google, so that we can actually have access. The data remains in the custody of the data producers in the HDSS sites, but we then can be able to create ETLs and OMOP instances that can allow collaborative research with the different partners. So that's something that the data science program, with partnerships from the London School of Hygiene, Odyssey Africa, Committee of Data, really working on to build the Inspire as a federated place where data is kind of in a repository, but federated, but at the same time, you can actually use it for research that is of interest.
Thanks very much. I see 2 hands and then some 2 questions too. Please, Grace, can you go ahead with your question?
Yes, thank you very much for the great presentation. I would just like to inquire on how can the communities, the local communities, be engaged in the long term? Because I do understand most of the research outputs are really helpful when it is gotten from.
Oh, sorry.
No, I'm asking like how can the local communities be fully engaged in the long-term research projects so that they are able also to be the first consumers of whatever is being propagated by the research outputs. Maybe I don't know if it is directly to the organization that has asked, has just presented, or it's maybe anyone who is ready to answer that can be able to assist. Thank you.
Oh, thank you, Grace. Yes, so one of the things that we believe is that the data producer really should be the first beneficiary from the data outputs that come through the work. And in fact, if you are at APHRC and you do work and you stop at a publication, if you're going through your appraisal, you'll be asked, so what next? So where did this work end? How did it inform policy? How have the results actually reached the communities from where you collected the data? So we are very keen on dissemination and working closely with the communities where the data are collected. Through the Inspire network, we do have a lot of annual general meetings where we do feedback with the HDSS sites where the data are collected. Through the different collaborators, there's a lot of dissemination so that the health literacy in the communities is improved. And if there are policies that are generated from the data, they can easily be absorbed. So that's a good question, but it's still work in progress. And it's something that we are being very intentional on as an institute.
So Jacqueline has put up a question to know if there are opportunities for partnerships with other universities in Uganda.
Thank you, Jacqueline. Yes, we do work with different universities beyond Uganda. In Uganda, we have work with Makerere University. We do have work with Bara University, and we're really open through the partnership model. We are very, it's an African think tank. So we do believe in a lot of partnerships. For example, there's a lot of work that goes through a program that has been in existence for about 5 years. This is the Qatar. And the Qatar has trained over 200 scholars. Some of these are PhD scholars all across African universities. So there's a lot of work that is going through with regards to collaboration with different African universities. Through our HDSS sites, we do work with universities that actually contribute to these surveillance sites, like the Kilimanjaro Christian University in Tanzania. We do have work in Senegal with different universities. So we are open to partnerships, and we are very, very, very keen on that. So we'll be happy to collaborate with anyone.
Great. Jim Todd, your hand is up. Can you pick your question?
Okay, thanks. Hope you can hear me. Yes, just want to reiterate what Agnes was talking about there with the federated databases. What we're doing here with the Odyssey database is we're trying to encourage the use of a common data model, which means to say that within the Odyssey data, it will be a common data model. In other words, the same data will be available from in different places. And this would really be encouraging what is in the questions there, in the chat there, as a local hosting capacity. Every institution who collects the data would be encouraged to have their own Odyssey common data model, which would then enable them to put the data into the Odyssey database using the ETLs that have been developed by Inspire or other Odyssey users, so that they can keep control of their own data, but that data, because it's common and because it's has the same structures and the same vocabularies, the same definitions, concepts as other data, can be then put together in order to be analyzed across a larger number of institutions. And so it does enable the analytic capacity to be increased, because the data are then put into a format where the same analytic procedures can be used in different places. And so it really is about developing local hosting capacity, as Vincent has said. But of course, in that case, we do need to have data scientists in these institutions learning how to implement Odyssey instances in their own institutions. It's not something where Inspire is going to come around and install these in your own institution. It's going to, we can provide some training, we can provide some help, but ultimately it's about data scientists learning how to use these capacities themselves in their own institutions.
Thank you, Jim. So there's a question from Faisal. What type of data is the Inspire project capture? And do you publish regular information from such data back to providers and public?
Yes, I think I'd answered that with
okay.
yeah, but I can add on to that. Yes, we actually interesting, because one of the things that comes up from engagements from the communities, that some of the languages or the format, the package in which the results that data scientists produce cannot be absorbed by the community. So we are learning on board. We are actually bringing a data communication so that they can help us repackage our results in a manner that can be really appreciated in the communities where we collect the data. So it's something that we are still doing and learning on job, but it's very important. But I also wanted to add on to Jim's responses that the Inspire Network does hold virtual trainings in introduction to OMOP, introduction to these common data models, how do you make your data fair? And we try to hold these on demand. We currently have a team of about 200 data professionals that are going to be trained across Africa in data science and climate. And in there, we also, put in aspects around harmonizing, standardizing data, because we believe that if the data scientists in the continent are well equipped, then we can be able to have more federated instances and OMOP instances and common data models and standardized data that remains in the hands of the data producers, but available for collaborative research. So we can share some of the material on the Inspire website.
Stevie Moore, I think you have your hand up.
Yes, so my question is regards to, because I saw the Inspire model, the Inspire has some mathematical model, ML models and stuff. And I'm wondering how they use these models. Do they develop? So sorry, I'm Stephen Moore from the University of Cape Coast. I'm from the Department of Mathematics, as well as Coastal AI. So basically, I do a lot of mathematical models for epidemiology as well. And so I'm very interested in your models, how you incorporate other models. Do you develop your models, or you look at literature for these models? Thank you.
Thank you, Stephen. Yes, as you know, the modeling process is, it depends on a lot of assumptions. And if you don't have the data within your team or within the study that you're actually using to the modeling, then many times you have to reach out to alternative data sources to kind of get estimates or assumptions that will help you in making the right model fit. So one of the things we are trying to build capacity in at the data science program is agent-based modeling. And we are leveraging the data from the community, the population health longitudinal records, to get estimates on certain aspects that might be unavailable out there or might be better informed using these community data sets. For example, if you want to do a model around family planning in a certain country or community, we can easily turn to these HDSS sites and get kind of fine-tuned local data points or assumptions or estimates that are that are collected from the communities where the data are collected. So it's a mix of many things. I think I would say that we use both what we have internally from the different studies that we've used, but most importantly, if we feel that there are estimates or proportions or certain statistics that we don't have, we can literally leverage these HDSS sites to produce this data, and that's the power of the network. And as we build capacity in mathematical modeling, is something that we are being intentional on.
Okay, but I'll be happy if you can collaborate, I'll be also happy to do that as well, to test
Sure.
some of my models as well.
Okay, if you can drop me an email.
All right, I'll do that.
Yes, thank you.
Great. I think there are two other questions. I think one is about the opportunities for private investors, which also ties in together with the fact that how do individuals become aware of these, your trainings and workshops? Maybe you could just put that together.
Oh, yes. Thank you, Faith and Jacqueline. We I agree that we've only opened up our website, and I can post that in the chat. And this is still work in development, but on the website, you can see the trainings that are held by the Inspire and when they be held, what the models are and how often they'll be held. And this is a website that we are still developing, but we can always share this with the DSI Africa at any one time when there is a training that's going to happen, and you should be able to get an update on this. And then with regards to private institutions, I think we are open to any public, private. We are in for African collaborations and with no restriction of public or private universities. So if there's any project that you want to collaborate on or trainings, we are really happy to do that. Okay, thank you, Stephen.
I still see Grace hand up. Do you still have a question, or this is the old hand?
No, sorry, it's the old hand. Thanks.
Okay. All right. I think there's one follow-up from, okay. Can you please share your email? Okay, that's from Steve Moore. Are there other questions? So, well, I would like to thank Agnes for your presentation. Maybe you can say a few words to wrap up.
So I got to have the whole session by myself.
Yes, exactly.
Yes, so thank you everyone for the engaging questions. And I think my take home is public health is going to certainly be informed with a lot of advances in data science, in AI, and the onus will be on us as data scientists to have skills along the whole value chain, right from data curation, creating, standardizing this data, making our data fair, and being in an environment where we can share our data to inform African public health challenges. So I'm happy about the discussions, and I'll be looking out for any collaborations and any persons who are interested in capacity building as we build a community of data science in Africa. So thank you so much, and I appreciate the time.
Thanks very much, Agnes, and thanks very much to all the participants. We sincerely apologize for the other presenter who was not able to join us. Hopefully we have the emails, and you can do the contacts probably to get to know more about that. I see there's some. Okay, sure. So thank you everybody so much, and we can get back to the main room, and then we proceed with the rest of the evening.
Thank you all.